Hi, and welcome to Product Talk Showcase. I'm Mike Hughes. I have with me today Dr. Nelson Hendler. Dr. Hendler was former president of the American Academy of Pain Management and former president of the Reflex Sympathetic Dystrophy Association of America. He has written 3 books, over 30 medical textbook chapters, 58 articles, and is widely recognized as an expert in chronic pain diagnosis and treatment. Dr. Hendler, welcome.
Thank you very much, Mike, for having me talk to you. Basically, there's a variety of reasons why patients are misdiagnosed, and I'd like to tell you why that happens, what are the most commonly misdiagnoses, and then how you can get a more accurate diagnosis to take to your doctor. If you have a, quote, sprain or strain that lasts longer than 2 or 3 weeks, by definition, it's not a sprain or a strain. And you have to think of sprains and sprains as phenomena that are self-limiting and self-curing. A spasm is different. A spasm is an epiphenomena. That means it's a phenomena that sits on top of an underlying pathology. It's sort of like elevated blood sugar in diabetes. The pathology of diabetes is not elevated blood sugar. It's the inability of sugar to get into the cell to allow the cell to use the sugar for its metabolism. But the thing which you can measure is the elevated blood sugar. So that's called an epiphenomena. Well, a spasm is an epiphenomena due to problems with muscles, problems with bones, problems with joints, problems with ligaments. And I've seen patients who've been called sprains and strains that have had it for 2 or 3 years, but by definition, a sprain or a strain is self-limited to 2 to 3 weeks. So if it's not a sprain or a strain, what is it? And that's what we're going to answer in the next slide. Now, when a sprain or strain, or what is called a sprain or a strain, lasts more than 6 weeks, what is it really? If a ligament pulls off the bone, there's excessive motion around the joint. This causes muscle spasm because the muscles now have to do the work of the ligaments to hold the bones together. And when a disc is damaged and there's a loss of disc space height, then there's less tension on the ligaments that hold the vertebral bodies together, and there's excessive motion around that vertebral segment. That again causes spasm. One of the most commonly misdiagnoses is Facet syndrome, and this can produce pain in the neck, the shoulders, the upper arm, or the low back, or the back of the thigh. The most important concept is that the pain of Facet syndrome is made worse with extension, that is leaning backwards, and is made better with flexion, that is leaning forward. And you get temporary relief with facet blocks at the level above, at the level itself, and the level below. Since the facet joint is innervated, that means it receives nerve fibers at 3 levels. And if you have a facet denervation, to take away the pain, you got a 40% chance of up to 2 years of relief. So let's take a look at the next slide, which shows the anatomy of a facet joint. On this slide, you can see the vertebral bodies. These are the bones that really make up your spinal cord, your spinal column in the back. You see the third one down says normal disc height. That disc serves as a cushion between the bony vertebral bodies. The next one down shows vertebral slippage due to reduced disc space height and lax ligaments. That occurs because the disc space narrowing and vertebral displacement occurs because the disc is smaller than it should be. When that happens, you have excessive motion around that joint, and that produces the nerve impingement and the Facet syndrome in the back of the vertebral bodies. Another often misdiagnosis is thoracic outlet syndrome. The clinical features of this are numbness and pins and needles and tingling and weakness, especially when you hold your arms up over your head. And that's one of the classic manifestations of thoracic outlet syndrome, or the classic set of symptoms. There are 2 types. One is vascular, that occurs only in about 10% of the cases, and the other one is nerve compression, or a combination of both. And when you have the vascular compression, you'll get the results that you see on the next slide. The ruse maneuver is exactly what we've described. It's holding your arms up so your palms are up, and it's like you're being held up when someone says stick them up. You hold your arms in that position for 3 minutes, and if you get pins and needles and tingling or coldness in your hands, that means that the nerve or the blood vessel supplying your arms is being compressed, and you have thoracic outlet syndrome. And if you actually measure this by looking at the blood flow in the arm, you get the set of results that we have on this slide.
If you wish to find out what is really causing your pain, visit diagnosemypain.com. For only $49.95, you'll take an online medical questionnaire. It has 72 questions with 2008 possible answers and is computer scored. It will take you only between 20 to 60 minutes to complete the test, and your results will be emailed to you directly in just 5 minutes. The test will give you diagnoses which correspond to the diagnosis from Johns Hopkins Hospital staff diagnosis 95% of the time. Take these diagnoses to your doctor and have him confirm them, and then order the right test to get you the right treatment. Thanks for joining us on Product Talk Showcase.